Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Tonight, we are talking vaccination and vaccination for pregnant women and women in general. And joining me tonight are the two gorgeous Dr. Nisha Ghote and Dr. Pallavi Sharma. But before we start talking tonight, I'd like to begin by acknowledging the traditional owners and the custodians of the land on which we are meeting tonight. I also pay my respects to their elders, past, present, and emerging. Hello, ladies. Thank you so much for joining me.
It's a pleasure to be here.
Thank you for having us on here.
Thank you, Pallavi. Thank you, Nisha. So, before we get into questions, um, would you like to tell us something about yourselves? Nisha, we go first with you.
Sure, I'll tell you something about myself. I am someone who absolutely hated cooking. I thought it used to be a chore for me. It was, one of those things you had to get it done because you had to feed the family. And the pandemic has shown me that actually I miss a few things. I miss the flavors and smells of my mother's cooking. And I find myself making the things that I remember hating. I remember telling her, Karele ki sabzi kyun banai hai? And now I'm making karele ki sabzi.
There you go. Pallavi?
I think I have found a new love with my long walks on the beaches. And I just can walk endlessly. And I found that the best rejuvenation for myself during this pandemic. Although, yeah, there were so many different things we were indulging before, but now this my newly found love has actually given me new energy.
You forgot to talk about you being a Bollywood actress.
Oh my God, here we go. That was just a one-off chance in life, which I took. I took a risk, I should say, which I had no idea. It just happened to come on my way. And I just accepted. It's called Pareshan Parinda, the movie. It's a very unusual character and very bossy lady, but probably helped me play with my inner strengths and just happened to do that role as a Thakurine in that movie. That's it.
We have to see it. I have to see this movie. Um, Nisha, should women get vaccinated and why?
The short answer is yes. All women should get vaccinated. Absolutely, they should. In fact, all of us should get vaccinated whenever we become eligible for vaccination. It is our only kind of defense that we have currently, amongst a range of other things, but the best defense we have currently is to get vaccinated. So by that, I don't say that we won't have to do things like distancing and that we won't have to, wear masks and things like that. But in that whole armory of things that we have to protect us, vaccination is a really important weapon, if you like. You can call it that, but a shield.
Okay. And Pallavi, are vaccines readily available? I know the government is saying it's readily available, but I can tell you my daughter, when she tried to get a vaccination, she had to book online and there was a 2 and a half week wait.
Now, Saleha, I think a majority of the people have their GPs, so they can be the best source of information to tell them where to go and how to make appointments. I can understand because if you go to a usual GP clinic, some GP clinics are doing Pfizer, some aren't. But then if you go to the website through, for example, if you're living in the Western region, so if you do Western Victoria COVID vaccine sites, so it will come up with a list of medical centers who are doing Pfizer. Try to find the one closest to you, book an appointment with them, and go ahead with that. So that's option number one. The option number two is you can go through different vaccination hubs. I can understand most of the phone lines are crashed or the booking appointments are all crashed. And I know it's being a mayhem at the moment because now people are just joining the race. Before, they didn't realize it was a race and they were complacent and just waiting and thinking. So now that they have taken that extra step forward, the places in the vaccination hubs are crowded. Be aware that there are two types of queues in the vaccination hubs. One queue is for the ones with the bookings and one is non-booking queue. So if you have a little bit of a patience, you can join the queue with no appointments and still end up getting vaccinated at the hubs. And it's a great facility. And very soon we are hearing that there will be churches, there will be schools or Bunnings taking over as a pop-up clinics. So it's quite, the hope is quite there. So not worrying too much. Yes, keep proactive, try to find out the nearest centers, the vaccination hubs, and the new clinics which are opening. And feel free to go into the non booking queue so that you don't miss out.
Saleha,
Okay.
I will add that we are talking about Pfizer because that is the vaccine that is licensed for pregnant women. But
Yep.
if you are not pregnant and you want to get AstraZeneca, which is a very good vaccine and is safe to have, then you will probably not face as many difficulties in getting a booking. The other thing is something, a website called COVID Q, which is definitely applicable in the bigger cities like Melbourne and Sydney, where you can check to see if there is Pfizer last minute available and you can go and get it. But that requires you to be sort of on your device all the
Yep.
time
Yep.
to
Yep.
see where the availability comes up. But there
There
are
is
a
a
few
little,
ways of getting it.
yeah, yeah. There's a little trick I'll add to what Nisha said. Now, this is off record, but I am on record. So I'm saying if people land at 4 p.m. at the vaccination hub, majority of the daytime rush and the crowd is gone, and they are so welcoming at the vaccination hubs that they, whether you want Pfizer, AstraZeneca, they're just there and just go ahead with it. And Nisha made a very important point. If you're fussed about just Pfizer, yes, so then you'll be waiting and waiting. So, in a way, you've got to be thinking the jab which you get in your arm is the best jab, rather it's thinking it's
Absolutely.
Pfizer or AstraZeneca.
Well, this evening's news, I think it was the 6 o'clock ABC news, where the government is buying 500,000 doses from Singapore.
Yes.
That's a big
So we
news.
get, so we have lots of questions already. Hi, Josna. I know it is all you. So there is a question for Nisha. Um, okay, she's asked a question even before I could say. And I'll add to that. What is your advice to young women? Okay.
So, my advice to young women is that both Pfizer and AstraZeneca are very safe to have if you are not pregnant and if you are worried about your fertility. There is absolutely no evidence at all to suggest that either of the two vaccines has any effect on fertility at all. What I will balance it against is actually getting COVID. If you get COVID and if you are one of those unlucky few who get long COVID, which is a chronic disease that stays with you for a very long time, possibly for the rest of your life, that
Wow.
affects your quality of life. That affects the way you can function as a normal human being. And that will definitely have impacts on your fertility and on your wish to have children. And so everything that we do in our lives is a balancing act. And on balance, it is much better to not get COVID and not get long COVID for fertility, for quality of life, for the ability and the wish to have children. And so, from that point of view, the vaccine is very, very safe for young women. It has no impacts on fertility, and you should go ahead and have it. Whether you have the AstraZeneca or Pfizer, both are safe.
Yep. I had the AstraZeneca. So here is a question for you again, Nisha. And there is also a question for Pallavi, but because Nisha talked about long COVID, can you please explain the symptoms of long COVID?
So I will actually defer to Pallavi to speak about long COVID because that is something that is more likely to be Pallavi's domain. But it
Yep.
is essentially a condition where you have long term symptoms that can range from sort of mild tiredness and chronic fatigue and those sorts of things to actually having symptoms that affect your nervous system, symptoms that affect all of your body systems. And so that is something that we don't know much about yet because we are only just discovering what long COVID is about, and all of the evidence we have comes from places which have had COVID for a while now, like the UK or America. But there seems to be a proportion of people who do develop long COVID, and it can be really debilitating.
Wow. Pallavi, would you want to tell us what long COVID is? And then I have another question for you.
Yeah. So until now, what we have heard from real life experience of families and friends who are actually suffering from long COVID, that's what I have been hearing, and I know those patients, which are either overseas or one or two here in Australia. Even though they have COVID and they've recovered and all that, they've had the vaccine, that tiredness, mental fatigue is constantly there and really wearing them out. They do feel that it's a different body. They are not their usual selves. It's been 18 months. One very first case, I knew a friend of mine, the very first case last year now, in March, she got it. And now the other one I know 8 months ago, still there, past COVID, had the vaccine, all done in UK, and she's still battling those aches and pains and all the fatigue. And it's just like she thinks her brain is not as smart as it used to be. So sometimes she
Wow.
questions her own cognitive power. Sometimes she says that there are some data saying that it can affect your intelligent quotient, especially in the young children, in the young population. So even though she's 48, she still questions me that I'm not as smart as I used to be. And it makes us think, oh my God, we are still learning so much about long COVID. There are so many things down the track we'll be learning. So it comes back to one simple thing. We always say the question is never, is the vaccine safe or not? Real question is the vaccine safer than getting COVID?
Yes.
So we all need to understand we'll either get vaccine one day when we decide, or we have to get COVID one day. So therefore, the virus is here to stay. So if we want to eventually be happy and have some freedom in life, and knowing the fact we will all come in contact with COVID, whatever, even though the vaccine we know, it doesn't stop transmission, it stops severe
Spread.
disease,
Yep.
hospitalization, ICU admission, and death, which is more than enough. So we eventually we will have to say, do I want to decide to come in contact with COVID or come in contact with COVID well protected and armed with the vaccine? So that's the decision we have to make.
And I think most of us will make the right choice. Um, Pallavi, another question for you is, can our international students get the vaccine? Are there any tips and advice around it?
Absolutely. Heaps of my patients contingent who are international students, and I'm so happy they are coming forward and asking this question. And this is actually a very smart question because that's what our community needs to come forward and realize. They all have student insurance. All
Yes.
what they have to do, they have to show their identification at a vaccination hub. Unfortunately, GP clinics, majority of the GP clinics are not entertaining international students. And that's because of the Medicare system, which does not link with them. So their
Okay.
private insurance people, when they go on their website of private insurance, they'll be getting an IHI identification number. So if they can get IHI number, walk into any vaccination hub and tell the name of their private insurance, they will be offered vaccination. Now, whether it's AstraZeneca or Pfizer, you just take it because
Yeah,
the
you
jab
just
in your
take
arm
what is
will be there.
available.
That's it. And protect yourself.
Yes.
And Saleha, Pallavi has said about IHI number and all of that, but actually you don't need anything. You can just walk into a vaccination hub or make a booking at a vaccination hub, take your ID with you, you will get a vaccine. And I can say that because my mother-in-law lives in Australia and she's not an Australian citizen. And I took her for her vaccination. We were asked no questions. She showed her Indian passport because she is Indian as her ID, and she was given the first dose and booked in for her second dose. And she has recently had her second dose as well. The same applies to international students. You do not need anything apart from a form of ID. Walk in, you will get vaccinated. The vaccine is free for everyone.
Luckily, our vaccination hub people are very friendly and they will help them out, even though you just take some ID and they'll help out, as Nisha said.
Okay. Thank you. So, hi, Rupali. So, my cousin is watching from Delhi and she has a question. Um, that is a question. So her question was, I needed to. Okay, no, she's come back with it.
So, Rupali, first of all, I would say that if you have had COVID, you need to have a time interval between having COVID and having the vaccine. And if you are in India, then the time interval will be determined by the guidelines in India. Which vaccine to have is a good question. Look, none of us are experts on particular autoimmune conditions. So, my advice to women who come to see me with particular autoimmune conditions is that actually we need to speak to the specialist who looks after you, and whatever medication you are on, based on that, we can then decide which is the best vaccine for you. In that situation, sometimes it might be wiser to have the vaccine in a hospital setting, because given you have an autoimmune condition, you might sometimes have a reaction to the vaccine. Anybody can have a reaction, but if you have a pre-existing condition, you're more likely to have a reaction. Have the vaccine in a hospital setting where you can then have treatment if you do have a reaction. As far as I am aware, both vaccines are very safe to have, even if you do have autoimmune conditions. But I would say speak to your specialist first, because they are the ones who are going to have the latest updated information about which vaccine would be best for you.
Thank you. So I will show you what she is saying. She said, I was waiting for mRNA vaccine,
She's right.
and another, the next one is, I don't have any autoimmune disease now.
Then that's fine. She just has to go ahead with the mRNA vaccine. If she doesn't have any autoimmune, markers right now, if she's not on any medication for it, then mRNA vaccine is absolutely what she should have.
According to Australian health guidelines, any person with any autoimmune condition is supposed to take Pfizer, and they are eligible for that. So mRNA vaccine is the only vaccine recommended at this stage for any autoimmune condition.
So she doesn't have it now. She had it 40 years ago, and she lives in Delhi. So what do you think is the best vaccine? Oh, she does say, she's saying, I have food and drug allergies, and there are no mRNA vaccines in India.
That's fine. In that case, as long as Nisha said her specialist is aware of that, she can still go for AstraZeneca, because at that is the guidelines in India. Here, Pfizer has been a guideline, so she has to follow the guidelines in India.
Yeah. Okay.
Saliha,
Thank you, Rupali. I hope that answers your question.
Saliha, it's really very important for women to understand that the guidelines are often based on how much COVID there is in a particular place compared to what vaccine is available in a particular place. So, women often come to see me in clinic and say, but in India, these are the guidelines. Yep. And the difference in guidelines between India and Australia or UK and America is the fact that in Australia, until recently, we had very little community transmission. And so we could actually be, we could put our nose up in the air and say, we'll only have this kind of vaccine and not have that kind of vaccine. Whereas in countries like the UK, India, America, where they have had so much COVID, they can't do that. They have to use the vaccine that is available, because that is the best vaccine for everybody there.
Absolutely.
That's why they manufactured their own local vaccine, Covaxin.
Okay, so she says, I'm patiently waiting in the wings. I am completely insulated for the last 4 months. No one coming or going out of home. Wow, that must be tough. I have another question from Swati. Thanks for watching, Swati. We have seen media reports that people who menstruate are reporting changes in their menstrual cycle after getting the vaccine. What are your observations and advice for people concerned about it? Wow, everybody's asking all my questions, so I don't have to do it.
It's good, isn't it?
Yeah, absolutely.
So yes, I have heard from a lot of women who have said that their periods were heavier after they had had the vaccine. It is important to remember that our menstrual cycles are very responsive to a range of different things. And just having the vaccine is a stressful event. If everything of, fertility and will I be able to have babies? Am I doing the right thing? Am I doing the wrong thing? All of that is playing on your mind. That by itself is going to have an effect on your menstrual cycle, because it is very responsive to all the different stressors we have in our lives. And so while I will acknowledge that it is possible that the vaccine does have an effect on the menstrual cycle. It is short lived. And so, even if you have a few heavy periods after having the vaccine, those will then settle down. It will go back to your regular cycle, and that is not a long standing effect. And it will definitely not affect your ability to get pregnant.
Pallavi, you want to say something?
I think these are such minor things, as Nisha said. Body will adjust. Absolutely right. When our antibodies are being built after vaccination, our immune system shows some alteration in the hormonal system. But our body has a mechanism to adjust after some time. So it will take another 3 cycles, goes back to fine, normal.
Okay. Now the questions come up. Thank you for watching, Avinash. Is taking vaccine during first trimester safe for the baby? Any risks?
So the vaccine is safe in any trimester of pregnancy. The risk, because you have asked specifically, is that sometimes after having the vaccine, you can get a fever. And having a high fever, for whatever reason, can have risks in pregnancy, especially in the first trimester. So my advice is that that doesn't mean you can't have the vaccine. Absolutely, you can. All you need to do is take some regular Panadol after you have had the vaccine so that you don't get that high fever. That's because the risk is not from the vaccine, the risk is from getting a high fever if you get it after having the vaccine. Take regular Panadol. It's very safe to take in pregnancy, it's very safe to take in the first trimester. Don't get a fever. The vaccine is safe.
Okay, Rupali says she's contemplating traveling to the US if when the country opens up. Okay, okay, Rupali. There is another question from Josna, which is Dr. Kaur, what advice would you give to girls with PCOS? What is PCOS? PCOS?
Yes,
PCOS?
PCOS is polycystic ovarian syndrome or disease. My advice to girls who have PCOS is that it makes absolutely no difference. Have the vaccine. There is no connection between anything to do with PCOS and the vaccine. You still want to protect yourself from COVID, you should still have the vaccine. Yes, you might get some period irregularities, but PCOS is probably means that you already have period irregularities, so that shouldn't make any difference at all. Get vaccinated.
Okay. So this was my questions. You hear a lot of myths within the community, Pallavi, and what are the common fears and what are the common myths that's floating around?
Oh, this is such a brilliant question. I tell you, it all started with big bombardment of vaccines cause autism, and that was working as a whistleblower for all the anti-vaxxers, basically. And then some people say that whole world population will come to an end, and then there's people will suffer from paralysis, and they'll have permanent brain damage. They'll have infertility. Men will be impotent. Women will have period issues. These were all myths created so that how to prevent vaccination. That was a big thing about this group of people who were just creating a misinformation pandemic. So now is the time we need to mentally inoculate ourselves against this misinformation pandemic and get our facts right. We need to know where are we listening all this information from, whom do we actually listen to, how do we empower ourselves from the correct websites, from the correct authorities, so that we don't actually get this scaremongers confusing us anymore with all these myths. So basically, coming all to this, if you see, for example, let's take one simple myth. For the last 20th century, there have been huge, humongous number of 2 million deaths, or you can say, due to polio, smallpox, diphtheria, all those people died in USA at that time, in the whole of the 20th century. And in 2016, suddenly, not one single person was dead due to smallpox or polio or diphtheria or any of these fatal diseases, and we prevented them totally. Isn't that a more better example that this is what vaccine does? But you know what? These mythbusters have to be curbed, and people's misinformation has to be cleared from time to time. one funny thing I'll say, some people said, oh, the asbestos are stuck in the mask. That was the most
Oh my
funniest.
God. I didn't know this. This is okay. We're so stuck in the I have another question for Nisha. Is the vaccine safe for lactating mothers? Thank you for
Yes,
watching, Rashida.
absolutely, Rashida. The vaccine, both AstraZeneca and Pfizer, are safe for women who are breastfeeding. The vaccine has no effect on your breast milk supply. It doesn't reduce the breast milk supply. It doesn't change the taste of the breast milk. It doesn't make your baby reject the breast or anything like that. You don't need to stop breastfeeding when you have the vaccine. You just carry on breastfeeding as normal, and it is absolutely safe to have during breastfeeding. In fact, if you have the vaccine when you are breastfeeding, just like in pregnancy, you might pass on some of that immunity to your baby, which will
Yes.
also protect baby. So it's advantageous to do it.
Um, okay. Vaccine is safe during. Yes. Okay. I don't know what Rupali is saying. New strains that have come up in the UK and South Africa reported that these strains escape the vaccine means breakthroughs. I don't know what that means.
So I think what
She,
is talking about is the vaccine effective against the newer strains that are emerging of the
yes,
coronavirus? And
in
the
South Africa. Okay. Yes.
yes. So from what
And
we
I,
know, the vaccine is effective against all the strains so far. Who knows how many more strains there will be in the future. But so far, what we know is that the vaccine is equally effective against the newer strains, maybe less effective against some of the strains, but that is emerging evidence.
and the
But
cycle
more
is going
research is
on.
going to be done, isn't it?
Absolutely. Absolutely. And you can't stop mutation. This is bound to happen just as every year we get a different influenza vaccine. Why do we have a different influenza vaccine every year? Because we got to make sure the new mutants come into the picture and we develop antibodies for those mutants. So that's why we need to alter. Same way, we'll be having one day a combination of influenza and COVID vaccine all in one. You never know. It sounds like a myth now, but we will need COVID vaccine every year as a booster to protect against the newer mutant strains. So rather than worrying about the future mutants, let's get protected against the current mutants and get the best jab.
Yes. So it's going to be like a flu shot. So it's an
Absolutely.
annual vaccination with a 2 week gap between the two, or a 3 week gap between the two vaccines, isn't it?
Absolutely.
Yes.
Absolutely.
Um, okay. So, Nisha, should everyone get vaccinated regardless of whether they are pregnant or not? Because sometimes we've heard that GPs are giving different advice regarding vaccination, especially if a woman is breastfeeding and pregnant. I mean, I think this is for both Pallavi and Nisha. So
Everyone
if your
should get
GP is giving you the wrong information, what do you do?
I think there, Nisha, are people talking GP giving wrong information about the pregnancy and the breastfeeding? That can't be possible. Even women who are remotely thinking and planning about pregnancy, go for the vaccination. That's what you need to do. If you get pregnant, again, think about vaccine. If you breastfeed, think about vaccine all the time because it's going to give protection, 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 and nothing else. What do you think, Nisha?
we have to acknowledge that there will be some of our colleagues who will not be abreast of the latest information, the change in guidelines, and will probably be giving women not optimal information. And if you find as a woman, your GP says to you something that doesn't fit with what everybody else is saying, what the national guidelines are, my advice to you is to get information, get a second opinion, go to a different GP if that is necessary, go to the Department of Health website, which has some really good information sheets in various languages that explain the different vaccines and what's safe and when it's not safe to have them. But don't accept information that isn't right, that doesn't sit right with you.
Thank you. So one of the questions I had from a mum's group that I follow is that what if they are 8 months pregnant? Is it still safe to have the vaccination?
Yes,
I
the
think people are
vaccination.
worried about the side effects more than anything else. Are they going to fall very sick? What is going to happen to the baby? I'm just guessing.
So at 8 months, I am guessing that mom is worried that if she has the vaccine at 8 months, will she have a preterm baby? And so, first of all, the vaccination does not increase your risk of having a preterm baby at all. But getting COVID does increase your risk of having a baby. It does
That's a
increase your risk of developing complications in pregnancy that then mean that you have to have a baby, or you go into labor and have a baby, and then that baby is preterm and requires to go into special care and have all of the things that preterm babies need to have. So if you're comparing, the vaccine is very safe, but getting COVID in pregnancy is not safe. And so get vaccinated. It is safe at any stage of pregnancy.
very true.
So, Pallavi, if I've had the baby today, how long should I wait before I get vaccinated? Is there a time frame? Can I do it within
There's no
3 weeks?
waiting
Can
time
I
for
do
that. Absolutely
immediately?
no waiting time.
Okay.
ASAP. Just get the jab and then pass on the antibodies while you're breastfeeding. That's the best thing for a mother to do.
Okay. So there shouldn't be any lag. It is okay to have the baby today and go and get vaccinated tomorrow.
Absolutely. Absolutely.
Okay. Um, okay. So there is a question from Rupali. She wants to know, do you have any idea or knowledge about Covaxin and Sputnik?
Now, this comes from my stay of 6 months in India in the last, from November last year until April this year, I was in India. So I had a lot of, I was called by one of my colleagues that why don't you join the Sputnik trial vaccines, which was the only vaccine available to me while I was there in India and had a chance to get vaccinated because I was not an Indian citizen, I was an Australian citizen. So I went into the Sputnik trials. I read about that because a friend of mine, that medical college itself, were doing Sputnik, free Sputnik vaccine to public. So that's, there you go. So they want me to try that. So the phase 3 trials were not completed until I was there because the analysis and the safety data of the phase 3 trials of Sputnik as well as Covaxin was not completed by that time. Therefore, it was not a very highly recommended one, especially coming from an Australian health guidelines point of view. I would certainly like to wait for phase 3 trials to come back and then check those results and then get hold of that vaccine. But somehow, when the population is humongous, the supply is so less, the demand is so high, what do? You just run helter-skelter to whatever vaccine you can get hold of and protect yourself. And that's why Sputnik was being distributed and Covaxin was distributed. Although the data I read about Covaxin was far superior to Sputnik at that time. Now, today, what information is available, I'm not abreast with the current knowledge of that. But yes, few months ago, that was the situation. Covaxin had a better status compared to Sputnik because of the trials and the data and the safety data released from that.
Okay. Um, I'm getting more questions. So, Rupali wants to know that with her condition, is it suitable for her? Do you think she should go for Sputnik or Covaxin?
Is Rupali the lovely girl who said about myasthenia, the autoimmune condition, if I'm not wrong?
Yes, yes, yes.
Okay. So again, as Nisha also pointed out, the same thing. She should certainly be in touch with a neurologist. And if they recommend that these two vaccines are safer, if she can't get hold of Covishield, which is far superior with all the safety data and the phase 3 trial results revealed and all that, that's fine as long as the specialists are happy for that.
Okay. Um, Another question from Josna. Do you have any comments on the adverse effects of Pfizer on the heart? Oh, I didn't know this.
Yeah, that's a very excellent question, and that question was put up by a 12-year-old yesterday in a consult. So this confident 12-year-old of Indian descent, he came to me and said, "I am now eligible for Pfizer. I read the guidelines, and what do you think can happen to my heart? Do you think I can get
Wow.
myocarditis?" there is a very small remote chance, yes, you can get myocarditis, which is actually inflammation of the heart. Now, that is, even though it's a small population, very small percentage which can get, it is quite treatable, and you know the symptoms. You explain the patient that this is the symptoms you can get. If you get chest pain, you feel sweaty or palpitations, just call the hotline or the ambulance. This is how it works here. And an ECG will be done, the treatment will be given, you will be fine, you will be rested for a few days and sent home. So it's not a disaster that you need to be scared and not go for the vaccine, because obviously the benefits of having the vaccine will outweigh the risk involved. So the risk of COVID too hard is way higher than the risk of the side effect of the vaccine, which is very remote.
Thank you. Um, this is from Mashi. Hi, Mashi. Thank you for watching. What would you say to people who want to try and get through the pandemic by only using exercise, vitamins, and herbal therapies to increase the strength of their immune system?
Okay, I wish one heart attack can be treated by that. I wish one neurological illness can be treated by that. Just once that is proven, okay, let them go through phase 3 trials. Let them go through the same um, uh, scrutiny what a vaccine trial goes through, and then the whole global population will start believing with evidence. So we practice evidence-based medicine. If any system or any other therapy gives the same result hand to hand, we have to have double blind trials side to side and get the best results, and then that any therapy can be believed if they give the same results side to side. I think Nisha would have known so much about double-blind trials and the data you get from any therapy which is evidence-based. So that is how we have been trained, and we will be backing anything that is evidence-based.
So I will
Thank
say
you.
to Marshi that the people who want to use exercise, herbal therapies, whatever it might be, multivitamins, to boost their immune system, they are worried about their immune system, isn't it? They care about their immune system. That's what they're saying, that, I'm doing all of this because I care about my immune system. I want the best immune system possible. And if you want the best immune system possible, why would you miss out on one of the key factors that actually does work on your immune system and makes it better, which is the vaccine? So
Vaccine.
by all means, continue exercising, have your herbal therapies, have your multivitamins, live a healthy life. I am 100% supportive of that. But add one more thing to your building your immune system with the vaccine, because the vaccine does help your immune system. That's all it's doing. It's not, doing any harm. It's just helping boost your immune system. So while you're using all of the other immune boosters, use the vaccine as well.
Thank you. Swati has a question for you. Do you think that concerns around AstraZeneca following reports of blood clotting and deaths here in Australia were exaggerated by the media? I think attitudes here have been really supportive of all vaccines, but are people also right to be worried? Fair enough question. I had
Very
AstraZeneca and my husband was very annoyed because I couldn't wait. Pfizer hadn't come and I just wanted to get vaccinated. Same with my younger daughter. She just wanted to get vaccinated and she couldn't get Pfizer. So she and I are the only one who've taken AstraZeneca. And yeah, 2 days I had a body ache, but I was fine. I mean,
it's a
Saleha,
very
as I said, sorry, go on. Go
it's
on, go
a
on.
very fair question.
Yeah, because I think, as we said in the initial part, that there has been a severe misinformation pandemic, along with what the other pandemic, the real COVID pandemic, which we are fighting. So you got to know the sources you are getting your information. If you do not talk to the right people, if you don't get the right information, obviously, as the question says, there has been a lot of social media factor also responsible for this misinformation pandemic. Therefore, now is the time we go through the right people, the right websites, get our facts right, and then channelize filter all the information and then confirm and go ahead. Yes, with AstraZeneca, the blood clots, like The risk of blood clot due to COVID is 1 in 4. The risk of blood clot in a young person is 1 in 50,000. So if you look at the risk and benefit ratio, obviously the benefits are far higher. What would you choose? Any sane man would say, I don't want 1 in 4 chance of dying. No way. I would go for something 1 in 50,000 and protect myself. So there you go. This is how the AstraZeneca thing has also been basically smeared by all different factors, but we can still go and get the right information and move forward.
I think the important thing is to recognize how much COVID there is in a society versus what risk there is with the vaccine. So when we started out with this whole AstraZeneca blood clots and, we changed the guidelines of what age can have it and what age can't, we were in a situation where we had very little community transmission of COVID. And so we could take the moral high ground and go, actually, we don't want any deaths at all, whether they be from COVID or from the vaccine. And so we will take absolutely the lowest risk path out of this. But that is not the case now. We have community transmission across the country, especially in Victoria here where we are and in New South Wales. And once that happens, then the risk of having blood clots with AstraZeneca is much, much lower than actually having really bad COVID disease. And like Pallavi said, having blood clots from having COVID disease far outweighs any risk from the vaccine. And so this is the time that anybody would say that actually now the balance has shifted and the balance is in favor of getting vaccinated.
Absolutely.
Whether that is AstraZeneca or not.
And today is actually a very sad day for Australia, because today I just heard a 40-year-old and a 60-year-old, they died at home. You know what? If any person could see one patient of COVID, unfortunately or fortunately, I was 6 months over in India, in and out of hospital due to lots of family cancers and all that. So I have seen people just sitting across me in a chair and just breathing out and waiting to be seen by a COVID ward doctor. So it's so sad when you see someone hungry for breath and starving for air. That is really, really sad. And these two people died at home. That was, I think, we don't want, none of us want to see that happen in Victoria. It's happened in New South Wales. We never ever want that to happen in Australia, which has stayed so much insulated until now. We haven't seen much death. We haven't seen people suffering what we saw on television being shown what was happening in India. I think.
Or what was happening in States.
Oh my God, but if we don't wake up now, when will we? If we don't want freedom, okay, how long can you keep yourself locking inside the four walls? I can understand the mental impact of COVID, the due to lockdown, people having lockdown mental impacts of really feeling depressed and all that. But again, if you see that mental impact and the depression due to lockdown versus the depression due to family members seriously ill in ICU, family members' funerals not being attended, come on. If you can't wake up now, when will you?
Yes. Rupali, I'm reading all your messages. Yes. She does say that everybody reacts to vaccines differently, moderate and acute. And yes, both Nisha and Pallavi know that you had your issues 40 years ago and that you still suffer allergies. Okay. So if you are a mom and you're breastfeeding and if you have a severe after effect to the vaccine, what do you do?
Nisha, do you want to say? Hello?
Sorry, I missed the question.
Oh, sorry,
Sanya.
Nisha, sorry. Did you help? Sorry. So if you're a mom with a little baby, or you're pregnant and you take a vaccine and you have a severe side effect, what do you do?
So that depends on when you have the severe side effect. If it's an immediate severe side effect, then wherever you are, there will be help available. Whether it is a vaccine hub or a GP clinic, you will get immediate help available. If it happens later, once you have gone home and you have a severe side effect, You do what you would do if you fell ill in any situation. You'd call an ambulance, you'd go to the nearest hospital, you'd go to the emergency department, and you would get help. What I will say is that there are very common side effects of the vaccine, things like pain, fever, feeling slightly unwell. Some people feel sick. Some people might even throw up. Those are very common side effects. And, fever can be easily treated with Panadol, rest up, those sorts of things. But absolutely, if you have any severe side effects, get medical help, whether that be via an ambulance, whether that be by a local emergency department. They will all be there to help you.
And whether
Wonderful.
you go to a vaccination hub or to a GP clinic, they are all equipped for emergency treatment to treat allergic reactions. So be confident you are in a safe place. It happened one patient only in the last few months, and we treated that with our injection in our clinic, and that was fine.
Okay. So this is if you have a child. What happens if you're pregnant and if you take a vaccination and then you have severe side effects? Does it affect the baby?
So, depending on what severe side effects you have, like I said, if you have the vaccine in the first trimester and you get really high fever, that definitely can affect the pregnancy and the baby, which is why take Panadol, even before you get the fever, take Panadol and take it regularly for the first 24 hours after having the vaccine. When you talk about other severe side effects, I'm thinking of things like an allergic reaction. Allergic reactions can be treated very easily. Like Pallavi said, whether it's a GP clinic or a vaccination hub, they should not have any side effects on the baby as such. So those are the two sorts of severe side effects I'm thinking of. Of course, if you get something like heart conditions or you get a blood clot, that has effects on the pregnancy. Now, AstraZeneca is not the one you would get in pregnancy. So with Pfizer, yes, you might get one of those rare cardiac side effects. They can be treated. Access your maternity unit. They will organize for you to get the treatment you need. It does not have any effect on the baby.
Okay. Thank you. If a woman has had a miscarriage, how long should they wait before they get vaccinated?
No need to wait. You can have a miscarriage and have a vaccine on the same day, following day. There is no need to wait.
Okay. Would you like to say something to the ladies who are going through this? Because I know there were some women who talked about it and they're not sure. I think one is the grieving part of it. It takes a while to get over all that and to
Absolutely.
go for a vaccination. I think they are worried. I don't know. I mean, I'm not in that stage, so I can only empathize with them, but I really don't know what. I mean, I'm sure you must be seeing and hearing women going through these situations every day.
Absolutely. I mean, yes, there is a grieving process and it is difficult to, even get out of the bed, never mind get out of the house and get your vaccine. But what I'm saying is that if you want to get the vaccine, there is no reason you need to wait. Absolutely, you should get the vaccine when you feel ready to access it, to get out of the house and get it. But from a purely medical point of view, there's no reason to wait. There is
Okay.
definitely other reasons to wait, and that might be something you want to do, and that's not a problem at all. But get vaccinated.
Pallavi, if I'm vaccinated, can I contract COVID? And if yes, why should I then get vaccinated? And there are many anti-vaxxers. You know that. We've seen that in Melbourne less than 2 weeks ago. That huge 4,000 people rocking up and then doing whatever they did. So my question for some, if I'm an anti-vaxxer, I'm pregnant, can I contract COVID even if I've been vaccinated? And then if I have, why should I vaccinate myself?
Now, you're talking of a pregnant woman who's been vaccinated with one dose or two doses.
I'll let you pick one or two, doesn't matter.
Okay, I'll take the best pick, which is two doses. Someone
Okay.
who's got the two doses has a really very, very remote possibility that if you contract COVID, first of all, you can contract. Anyone who has had two doses can still contract COVID. So saying that vaccine will stop you from getting COVID infection is not true. You can still get COVID infection. Now, how sick you will get, that's where the role of vaccine starts. So, two doses gives you immense protection, more than 94, 96%. That's the number which has been coming up with these vaccines. So, if you happen to be sick, then you will get cough and cold and a bad flu like symptoms if you've got the two doses. The chances of you being hospitalized, the chances of you being in an ICU, chances of death is guaranteed to be literally nil. So that confident you can be if you are armed with two jabs of these vaccines. So that's why whether you're pregnant or whether you're not pregnant or any general population, to say we can all contract COVID, yes, that is how we are going to learn to live with COVID. We will be having families, we'll be producing babies, we will be having meeting friends, we'll be hugging and having a normal life. And still with masks, with social distancing, gradually it will be like flu. We have the flu jab, we don't stop hugging each other. We will be able to at some stage later on, once we have the booster, once we get better and better with all the information coming through and we arm ourselves with all the vaccines, this is going to happen. So answer to your pregnant lady, if she is with one jab, the possibility of getting a severe disease is still there. The possibility of hospitalization with one jab is less, but still there. Yes, that is why getting the two jabs while you're pregnant, even before you fall pregnant, planning to fall pregnant, is the best time to just go and get this jab in your arm ASAP.
Okay. Um, okay, Rupali wants to know what is your panel's. Okay. We don't have this in Australia, do we?
No, we don't have that one.
No.
We've got only Pfizer approved for children
Yeah.
12 months, which is an mRNA vaccine.
Okay, she talks about in Kerala, people, both vaccines are getting COVID in equal numbers.
But then we
Yes.
need to know the data. If they're
Yes.
getting COVID in equal numbers, what sort of COVID infection? Now, again, how serious is that infection? We need to get the data right to complete this answer to this question. So, are they getting just a mild cough and cold? Or are they getting serious enough COVID to be hospitalized? Are they needing ICU admissions? Are they dying? We need more information to be able to answer this question properly.
And I think it also differs from country to country, doesn't it? I mean, in India,
Absolutely.
yes, the
Absolutely. The
population
demographic.
by itself, nobody
Yeah,
believes in this, physical distancing. Half the people don't wear masks. People are behaving life is, going back to normal. Here we don't. Here we actually listen to the government and, don't go beyond 5 kilometers, don't meet our friends, wear face masks. So I think it's all country to country.
It is.
absolutely. And you know what? The new theory also about viral, fighting a virus by a human body is also now the theory is coming, and more research in the American Academy of Sciences has been saying that we have an innate immunity. Every human being has their own innate immunity, like children. Why did we not vaccinate children below 12 years until now? They have better innate immunity to fight the viruses compared to adults and elderly people or pregnant women. That's why we were still waiting not to vaccinate children below 12 years because of their innate immunity, which increases the level of interferon and helps them fight all these infections. So that is why the demographics from place to place, country to country, how insulated like an island like country Australia is, or what other exposures, whether the borders are open here and there, multifactorial reasons how a country
Yeah.
can be affected with COVID.
Okay. We are nearing an hour. I'm going to ask my question before Josna has another question. So this is for both of you. If you are at an exposure site, should you isolate even if you are completely vaccinated?
Yes, you
Absolutely,
should.
I would say. Absolutely. Even though, sorry, Nisha, do you want to go first?
No, we were both saying yes at the same time. You go.
There you go. Because we both are very, very wishy-washy. Never say wishy-washy about all these vaccines. Straight to the point. Even if it's a tier one exposure site, if we have been fully vaccinated, we still have to isolate for 14 days. That's the guidelines. Unless Nisha has heard something different yet.
No, absolutely not. Those are the guidelines. The reason those guidelines are there is because double vaccination does not mean that you can't acquire COVID, and it does not mean that you can't spread COVID. You're less likely to get it, you're less likely to get severe disease, and you're less likely to transmit it, but it's not zero. And so, if we are trying to reduce that, then we should still continue with isolation. Now, all of this might change in the future once we get to a point where we feel confident to say that actually that's okay. Most of our population is double vaccinated, so that's okay. But we haven't reached that now. We're still sitting at somewhere around 30 or 40% if you look at the
Yeah,
whole of the
which is yes.
population.
Yeah,
And
yeah.
at that level of vaccination, we can't do that. We can't say that it's okay if you've been at an exposure site, you can just carry on as normal.
Yeah.
Yeah, and that Nisha has clarified that risk of transmission, risk of acquiring the COVID infection is not minimized by the vaccine. Yes, the severity of the disease, the hospitalization, and the death rate will go down with vaccination. And that's what is our first goal to achieve with double doses.
Absolutely. Um, so the last question for tonight, although Rupali says she is sad she could not get her answers that she's in India, and I believe there is no mRNA vaccine in India as yet. Is that true? I don't know.
I don't know either, actually.
Yeah.
Yeah. So here's a question from Josna. Suppose a woman is at 36 weeks, has one jab, goes into labor, baby is born. Would there be any or enough antibodies in the bub? Wow, I didn't even
So
think about this.
so there won't be enough antibodies because we know that the earlier you have the vaccination in pregnancy, more likelihood there is of passing antibodies to the baby. And if you are double vaccinated before you have the baby, then that is the best situation of passing antibodies to baby. But that does not mean that there will be no antibodies. Secondly, you will have your second dose when you are breastfeeding. So while you are breastfeeding, you will still pass on some antibodies via breast milk to the baby. And so, it's not the worst scenario possible. Yes, it's not the best scenario possible, but if that is what you can get, that is what you should get.
Yeah.
Yeah.
Take the
And
best
after the
option.
first jab, you get 56 to 67% immunity 7 days after the first jab, and 10 days after the second jab, you go to the 96 and the 94% immunity or the antibodies developing. So that's the best point. But then, as Nisha said, something better than nothing is that stage. Just get it into your system. So as time passes, she'll be actually protecting her baby.
Okay. Uh, okay. Rupali is just upset because she's isolating and she's not being able to get vaccination.
I'm so
Before we
sorry,
go,
Rupali. I wish I could help you.
We are giving you virtual hugs.
yes, Rupali, I love you. Um, before we go, any Josna says thank you, Dr. Kote and Dr. Sharma, for an informative session. So before we go tonight, um, what message do you have for all the ladies who have not been vaccinated, are scared of being vaccinated, still thinking yes, no, maybe?
I'll go first, Saliha. Before I go to your question, one thing that I do want to talk about is I have heard from a few people now who have had a vaccine early in pregnancy without recognizing that they were pregnant or without realizing they were pregnant. And they have said to me, I don't want to take any risk at all. Why would I take any risk with my pregnancy? Should I terminate my pregnancy? And my message to those women is that actually, no, there is no reason why you should terminate your pregnancy. The vaccination is safe, even if you have had it really early around that time when you conceived the baby. There is nothing to suggest that the vaccine is any effects on the pregnancy if you have had it that early. So that's my first thing. My second thing is that get vaccinated. Of course, I've said that right from the beginning. If you have doubts, if you have any questions, if you want more information, go to reliable sources of information. Go to the Department of Health, go to your obstetrician, your GP, whoever is looking, your midwife, whoever is looking after you in the pregnancy or while you're breastfeeding. Get reliable information. Don't go to the conspiracy theory websites and all of those things to get your information, because that will only give you misinformation and bad information. That will not help you. That will just scare you more.
Thank you.
I would just say, all these lovely audience for tonight, thank you for really being patient and listening to us. I hope both of us and all three of us, the knowledge we have shared with each other and the question answer session has empowered you girls, you females, so you can further transmit like viruses. You should be transmitting this knowledge to other women and empowering them and saying that they have to mentally inoculate themselves from the scaremongers. So they have to actually go ahead, get their jabs, and you should be now the best ambassadors and the best moms in future. So you have the knowledge, feel confident, and go ahead and be really the torchbearer of vaccination.
Okay.
And thank you for tonight.
Thank you. I have to ask this question because Rupali wants to know. Um, she had COVID in April, May, and she isolated totally. How long does she need to isolate and be protected? It is September now. I'm sure she can go out now if she's
Yes.
got her masks and everything.
Is
Rupali, I
she
hope
in
that
India or
answers your
she's in
question.
Australia?
She's in Delhi. She's in Delhi, and that's where the problem is because she's not getting her mRNA vaccine.
Okay, so she recovered from COVID in the
Yes,
month of May. She
May.
got
Yes.
caught it. Okay, so if she has recovered in May after catching the COVID in April, you said, obviously 6 to 12 weeks onwards, right? 12 weeks from the day she got the infection, she is free to move on, and she should build up her immunity with all the herbs and all the literally healthy diet and all that she must be quite knowledgeable about, and go and start exercising, have a healthy lifestyle. And then in India, this is what I have heard, after 3 months their Indian guidelines say they can get the vaccine. So if she is fussed about this vaccine and that vaccine, go to the right doctor and go through the pros and cons and positives and negatives of different variety of vaccines, and not delay. Just get the first jab in her arm, which will give her the best protection, rather
Okay.
than waiting the one she's dreaming of.
Okay.
Good
Rupali,
luck
I'm
to
sure you
her.
heard that. Yes. Good. Yes, I'll tell her that. I'll text her.
And
Thank you
I'm
so much,
passing my
ladies.
virtual hugs to all the girls who are feeling really down due to lockdown.
And I think that goes to all of us. Thank you so much for joining. Thank you for sharing your expertise. I'm
Thank
sure
you,
I will
Saleha,
see you
for having
soon. Thank
us.
you.
Yeah,
Bye.
thanks a lot.